Hello friends, today we are going to see diseases and disorders of digestive system and respiratory system. First of all, we will learn about what is mean by disease. A disease is an abnormal condition of a body, especially result of infection that disturbs the normal physiological functioning of the body. Means what? In a disease state, our normal functioning get disturbed. Mainly, diseases occur due to infection of a bacteria. Collectively, we call them as a pathogen. Disease of respiratory system: pertussis, tuberculosis and diphtheria. These are the three main respiratory diseases we are going to discuss today. Pertussis. The causative agent of pertussis is Bordetella pertussis. You can see the picture here. These are the short dot-like structures. They are nothing but pertussis causing agents, that is Bordetella pertussis organisms. Mode of transmission of pertussis: droplet infection. A person suffering from a pertussis, when sneezes or coughs, a droplet spreads in the surrounding. Along with the droplets, some particles or the bacteria come in the air, and through this air the pertussis spreads to the healthy individual. Signs and symptoms: severe coughing bursts, each cough followed by a whoop sound, hence pertussis is also called as whooping cough. Runny nose and vomiting. So these are the some basic symptoms of pertussis disease. Prevention and protective measures: vaccination. So you can see here vaccination. You must have experienced also vaccination in your childhood. You know the vaccine for polio. Patients should be kept in isolation. Cover your mouth while coughing and sneezing. Keep away from patients as far as possible, so that you will not come in contact with the patient and you won't become in the contact with the bacteria. Do not use articles used by patients. These are the some important preventive measures for the not spreading the disease further. Now, tuberculosis. The causative agent of tuberculosis is Mycobacterium tuberculosis. See here, these are the rod-shaped bacteria. They cause the tuberculosis disease. Mode of transmission: it is the same mode of transmission, that is droplet infection and infected cattle milk. Okay, I told you what is meant by droplet infection. Signs and symptoms: mainly infection of lungs. In the tuberculosis disease, our lungs get infected, due to which we lose the weight and we cough or we sneeze very oftenly. Sputum may contain blood. While coughing, when sputum comes out, it may contain blood. Fever, chest pain. Due to severe coughing, there is a chest pain. Treatment and protective measures: antibiotics, for example streptomycin, is a good medicine for the curing of tuberculosis. Vaccines, MDT, that is multi-drug therapy. You must have heard about this on the television. Patients should be kept in isolation. Cover your mouth while coughing and sneezing. Keep away from patients as far as possible. Do not use articles used by patient. Next is diphtheria. The causative agent of diphtheria is Corynebacterium diphtheri. Here you can see the blue colored organism which is responsible for the diphtheria. Mode of transmission, droplet infection. All these three diseases are the diseases of respiratory system and hence get transmitted through droplet infection. Signs and symptoms. Bacterial growth on mucous lining of respiratory tract. Inside of this tract there is a mucous membrane and which gets infected where bacteria grows. The fever, sore throat. Sore throat means there is a irritation of throat becomes red. Treatment and protective measures. Vaccine, antibiotics such as erythromycin. Patients should be kept in isolation. Cover your mouth while coughing and sneezing. Keep away from patients as far as possible. Do not use articles used by patients. These are the all protective measures to prevent ourselves from these three respiratory diseases. Now we will turn towards diseases of digestive system. Let's see which are them. First is cholera, other is typhoid, and third is bacterial dysentery. Now we will learn one by one in detail. First disease is cholera. Causative agent of cholera is Vibrio cholerae. See here in the picture you can see blue colored organism that is responsible for the cholera. The specificity of this organism, the shape of this organism is like a comma. Mode of transmission. Now this is not a respiratory disease, it is a disease of digestive system. So the mode of transmission is different. So mainly the contaminated food or water with feces is the main mode of transmission for the cholera. Vectors, for example flies moving from human feces to food. You must have observed when we eat or open food there is a gathering of flies on the food, and this fly may come from the human feces to the food and they spread the disease. Signs and symptoms: inflammation of gut, severe diarrhea, dehydration, loss of salt. Means what? During diarrhea we lose much more water through the diarrhea. So this condition is called as dehydration. Treatment and protective measures. Anti-cholera vaccines. Antibiotics such as tetracycline, chloramphenicol. Clean water supply. Safe disposal of sewage. Hygienic preparation of food. Means what? The water coming to our house should be clean. It should not be contaminated with the sewage water, because we have seen the disease spreads through the fecal contamination. Hygienic preparation of food. Food must be prepared in a clean places. Typhoid. Causative agent of typhoid is Salmonella typhi. These are red color bacteria which you can see in the diagram are the causative agent. Mode of transmission, again contaminated food or water with feces. Vectors, for example flies moving from human feces to food. Signs and symptoms of disease. Initially mild fever. If we don't treat the fever initially, then it spreads and increases gradually. Diarrhea, ulcers in intestine. Ulcer means what? There is a wounds in the intestine. Treatment and protective measures. Anti-typhoid vaccine, antibiotics such as ampicillin and chloramphenicol, clean water supply, hygienic preparation of food. So water that we are consuming should be clean, and food that we are preparing should be at the clean places, or food we are eating that should be from the clean hygienic places. Bacterial dysentery. Causative agent is Shigella dysentery. These are the bacteria of Shigella dysentery. Mode of transmission: contaminated food or water with feces, vectors, for example flies moving from the human feces to food. Signs and symptoms: abdominal pain. Abdominal pain is mainly concerned with the stomach pain. Bloody diarrhea means from your stools there is a loss of blood. Dehydration, that is loss of water from your body through the diarrhea. Treatment and protective measures. No vaccine is available for the bacterial dysentery. Antibiotics, for example tetracycline, this treatment is available. Again, clean water supply, hygienic preparation of food, etc. So here you can see the picture, people eating food on an open stall. So there is a big chance of transmission of diseases like typhoid, cholera or dysentery. So that's why we are always advised not to eat food on the open stalls. Thank you.